Now, what or which concepts they mediate this response? So it starts with the brain, the spinal cord, the hypothalamus, the adrenal, the pancreas, and the sympathetic nervous system. And the important point to understand is there is genetic variability in any kind of response to injury. So there will be a quantitatively different responses according to the genetic variations. So the pro-inflammatory response syndrome may get converted into counter anti-inflammatory response syndrome over time. So what happens is that due to any kind of injury, there will be a stimulus from the brain to the hypothalamus through the pituitary to release the corticotropin releasing factor. So that will be released, which will lead to increase in ACTH and growth hormone. So both of them have a lipolytic effect. So that will lead to adipocyte lipolysis. Now this ACTH will work on the adrenal to secrete the adrenaline and cortisol, that is both the glucocorticoid and the mineralocorticoid, and that will lead to hepatic gluconeogenesis. Now this will also act on the sympathetic nervous system, that will also act on the pancreas to secrete glucagon. So there will be an increase in the glucagon in the body. Now all in all, this will lead to skeletal muscle protein degradation, hepatic acute protein synthesis, acute phase protein synthesis. Now this, that is the endocrine system, will act with the immune system. So that will lead to increase in the pro-inflammatory cytokines like IL-1, IL-6, IL-8, TNF alpha. That will lead to pyrexia, and there will be decreased in the levels of I cube T3, that is insulin, insulin growth factor 1, testosterone, and T3, and all in all there will be a hypermetabolism. So this is the response to injury what normally occurs in the body.